Hello everyone. In this video, we will continue with our lecture series on pharmacodynamics. So in this video, we will talk about dose-response relationship of the drug. So this relationship is between the dose of the drug, which is plotted on x-axis, and the response which is achieved in the body, which is plotted on the y-axis. So normally when we plot this relationship, it is plotted as a rectangular hyperbola. That means there will be fast increase in the response and then it reaches a limit. So this relationship is achieved very fast, the maximum response. However, when we plot the same relationship with the log of the concentration of the dose, so in logarithmic scale we are plotting, now the relationship we find is actually sigmoid in nature. Okay, so we get a initial increase in the response which has a flat kind of appearance. So you see the slope is very less. Then we get an increased slope, and then again the graph becomes little flatter. And this response, the response between 30 to 70% of the response is almost linear with the concentration of the dose, which is taken in logarithmic way. Okay, so log concentration of the dose. Now, basically we are seeing that response is proportional to exponential increase of dose, and this is related to Weber-Fechner law. Okay, actually all physiological responses follow this Weber-Fechner law. That means they happen in log scale, and this Weber-Fechner law I have already explained in another video as well. So to clarify the concept, you can watch that video. Okay. Now, before we proceed, remember when we talk about dose-response relationship, basically there are two aspects in this. When a dose is given, there will be increase in the plasma concentration of the drug. So, there is a dose-plasma concentration relationship, and then based on whatever the plasma concentration of the drug is, we will get a response. So, there is a plasma concentration response relationship. And this dose plasma concentration relationship is in fact dependent on pharmacokinetics, which we have already dealt in our lecture series on pharmacokinetics. That there will be absorption of the drug, then the drug will be distributed in the various volumes within the body, and a particular plasma concentration will be achieved at equilibrium. So that is based on pharmacokinetics. However, when there is increase in the dose, there will be increase in the plasma concentration, and because there will be more drug within the plasma, obviously there will be increase in the amount of the drug at the receptor level. And when we talk about pharmacodynamics, we are talking about how the drug is acting and how it is binding to the receptor and what are the changes it is making to the receptor. So if plasma concentration increases, the drug concentration at receptor level increases, so the drug response also increases. So that is why, because all this is connected, we are directly talking about the dose response relationship. Now we should also know that why we want to study this dose response relationship. First, when we plot this graph, it tells about a wide range of dose and response. Okay, so we will know the dose range in which the drug is most active. Say suppose this is the dose response curve of first drug and this is the dose response curve of next drug. We see that okay, this particular drug, say suppose if we take a particular dose, this dose we take, and what we see that A drug is having this much response with the particular dose, and B drug is having another response. Okay, and for A drug we see that okay, if we want that response should be in this particular range, then we will know the dose range in which the drug is going to have that particular response. Okay, then second is that comparison with different drugs, as I compared between A and B. Then there will be comparison of agonist with antagonist, which we are going to see in next video, that what are the agonists, different types of agonists and antagonists, and how they shift this dose response curve. Then we will also see, which we are going to see in this video itself, that if a drug has multiple effects, that is the therapeutic effect and adverse effect, then what is the dose in which the therapeutic effect is going to occur and what is the dose in which adverse effect is going to occur. So basically when we study this dose response relationship by looking at the maximum response, the slope of the graph and the position of the graph. So this is the maximum response, right, for A, and this is the maximum response for B. Then what is the slope of the graph? That means how it is rising, whether it is like this or it is flatter. Then position, that means where in this plot where the graph is located. So suppose this A is located on the left side and B is located on the right side. So we will study these three components to understand the dose response relationship and to deduce the property of the drug. So here is an example of certain drugs with dose response relationship. So this is drug A, drug B and drug C. Now say this graph A, at particular dose there is maximum response, right? So here at a particular dose there is a maximum response. But if we compare drug A and drug B, the maximum response is same both for drug A as well as B. So if two drugs have same maximum response, that means they have same efficacy. Okay, so A and B have same efficacy. So what is efficacy? Efficacy is that how much response is occurring. Maximum response we are seeing. If it is same, then the drugs have the same efficacy. For example, if we talk about morphine and aspirin, then both are the drugs which are used for reducing pain, that is for analgesia. But morphine has more efficacy compared to aspirin. That means aspirin doesn't has this much reduction in the pain. Okay, somewhere here it will be there. That cannot be achieved. That much reduction in pain cannot be achieved with aspirin. So this efficacy is basically upper limit of the drug response curve. Second component is potency. Potency is that how much dose of the drug is needed to produce a particular response. So here A and B are having same efficacy, but if we see the dose, say suppose we take this particular dose, and what we see that with this particular dose, B drug is having only this much response, very less. On the other hand, A drug is having huge response with that particular dose only. So in this case, A is more potent. A is more potent than B. So simply if we are seeing the position of the graph, you see that a graph which is on the left side is more potent compared to the graph which is on the right side, right? So we have discussed about the maximum response, we have discussed about the position of the graph. Position of the graph is telling about the potency. So if we compare C and E, C is more potent, but C is less efficacious than A because the maximum response is lesser. Okay, so this potency, the measure of potency is EC50. What is this EC50? EC50 is the short form for half maximal effective concentration. Okay, half because 50, half maximal effective concentration. That means the concentration of the drug at which we will get 50% of the response. Okay, so EC50 of A, if we see, it is much lesser, while for B it is much higher. So say suppose if this is 50% of the response, then for drug A we are getting this much dose. For drug B, higher dose is required. That means A is more potent than B. Now, third thing is slope. Whether the slope is flat or the slope is steep. So, if there is another drug, say suppose something like this. So, this is said to have a flat slope, and what we see that basically over a range of the doses, say suppose these many doses if we take, then the response which is there, it is changed very little. However, for a drug with much higher slope, same range of doses you see, say suppose for B we are seeing, what is happening? With the change in the dose, the response is changing too much. For a flat curve, it is changing lesser. That means a drug with a flat curve, standard doses can be given to most patients because hardly there will be change in responses. However, for a drug with steep slope, very steep slope, dose individualization needs to be done because the response is going to be increased, and moreover there might be much variability from person to person as well. So dose individualization needs to be done. Now, what are these used for? Slope, I told you that yes, by looking at the slope of the curve, we can tell whether standard doses can be used or dose individualization can be done. Potency decides on the dose of the drug. potency decides on the dose of the drug. More potent means lesser dose is okay for the response. Okay. For example, if we compare morphine and pethidine, they are having the same efficacy, but morphine is much more potent. So the dose required will be much lesser. Then efficacy affects the choice of the drug. Okay. Potency decides the dose of the drug. Efficacy decides the choice of the drug. That means, say suppose if pain is too much, say suppose in palliative care, whether we should use morphine or aspirin. So we have to decide which is having more effect. Then for example, the use of diuretics. Loop diuretics are used in cardiac failure. However, thiazide diuretics, which have less efficacy, they are used in hypertension. So that was about the various components of the graph, that is potency, efficacy, slope. Potency decides the dose of the drug. More potent means lesser dose. Efficacy decides the choice of the drug. Okay, which condition, which drug to use. And slope will decide whether a standard dose has to be given or dose individualization has to be done. Now, before moving on, just remember here that potency depends on both affinity and intrinsic activity of the drug. This component we brought in our first lecture, what is affinity and intrinsic activity of the drug. Affinity is, that is the binding of the drug to the receptor, how much strength of binding is there. More strength of binding means more affinity. Intrinsic activity is that, say suppose this is the receptor, and once the drug binds on the receptor, which is affinity, what happens downstream, whether this receptor is blocked or there are downstream events happening. So that is the intrinsic activity. Okay, more details we are going to see in the next video where we talk about agonist and antagonist. Okay, so this is affinity and intrinsic activity. Potency depends on both. Efficacy depends only on the intrinsic activity, that is the maximum response. We are not bothered that what is the binding. What is the maximum response depends only on intrinsic activity. That means downstream what is happening, right? Then this dose response relationship also helps us in differentiating the multiple effects of the drug. For example, if we are using a beta agonist for bronchodilation in asthma, so this becomes a therapeutic effect of the drug. However, there might be other effects of the drug, for example, cardiac stimulation. So this becomes an adverse effect of the drug. Okay, so one is therapeutic effect and the other is adverse effect. Now we have to plot the dose response relationship for both of these effects. It will not be same. If it is same, that means for the same drug, for the same dose, we will have the therapeutic effect as well as the adverse effect. Then it will become very difficult to choose the dose of the drug. In fact, that drug may not be useful at all. So when we choose a particular dose, we have to see that how much therapeutic effect is occurring and how much adverse effect is occurring. So we will see in the next slide that how this helps us in choosing a population therapeutic window. Okay. So this gap between therapeutic effect dose response curve and adverse effect dose response curve we have to see. Actually, this helps us in deciding dose at which plasma concentration will be attained, at which there will be a drug will be therapeutically active but not much side effects. Okay, so we have to choose a dose at which the drug will be active for the disease but not much side effect. For this, we have different indices. One is therapeutic index. Therapeutic index is equal to LD50 divided by ED50. LD50 is the median lethal dose. That means a dose which is going to kill 50% of the population. ED50 is the median effective dose. That is the median dose at which 50% of the people will have therapeutic effect. Okay. LD50 where 50% will be killed, and ED50 the dose at which 50% will have therapeutic effect. Obviously, we cannot do it in human beings because we cannot decide that the dose at 50% will be killed. Nobody does such experiments. So this study is done in lab only. But a better therapeutic index, because this therapeutic index is calculated in animal studies only, a better therapeutic index is clinical therapeutic index, which is determined by dose required to produce toxic effect divided by concentration required to produce therapeutic effect in population. Okay, so here we are telling that when the toxic effect will occur, so that is dose we take and divided by concentration required for therapeutic effect in population, right? Then third is therapeutic window. So this therapeutic window we have discussed in our videos on pharmacokinetics, where we said that therapeutic window is a range of the plasma concentration of the drug. Okay, so here y-axis is showing the plasma concentration, range of the plasma concentration of the drug, that is between the minimum effective concentration. Minimum effective concentration means the drug concentration at which the therapeutic effect will be there, and the minimum toxic concentration. Okay, so the dose at which the toxic concentration toxic effects will appear, or the adverse effects which is acceptable. Adverse effects which are acceptable are also can be here. Okay, so the maximum acceptable adverse effect, that means this is the adverse effect which can be there, we will tolerate it, but not above this. Okay, so maximum acceptable adverse effect, the dose at which this occurs. So the range of the plasma concentration which comes between that forms a therapeutic window. Okay, another is therapeutic window for population, that is a population therapeutic window. Population therapeutic window, what is that? So that we can determine by this dose response relationship. So here blue graph is for therapeutic response, red one is for adverse effect. So what is the dose range at which maximum population will get maximum benefit, but some percentage of population can experience toxic effects as well? So if we see in this graph, what we see, that if we see this dose range, we see that okay, there will be maximum therapeutic effect, but you see here that some percentage of population will also start getting the adverse effect. Here some population may not get, but some population may also start getting the adverse effect. Okay, so this is the population therapeutic window. We cannot extend beyond this. Say suppose if we extend, then there will be lot of population which will get this huge adverse effect. Okay, so that way we decide what should be the dose range, acceptable dose range for a particular drug, right? So that was about the dose response relationship. The remaining part of the pharmacodynamics we will deal in the next video. Thanks for watching the video. If you liked it, do press the like button, do share the video with others, and don't forget to subscribe to the channel Physiology Open. Thank you.